Sickle cell disease is a hereditary disease that is caused by an abnormality in the hemoglobin in red blood cells. Hemoglobin is a component of red blood cells. It can bind and release oxygen. Red blood cells collect oxygen from the lungs and transport it to the rest of the body. Normally, red blood cells are a round shape. In sickle cell patients, red blood cells are initially also round, but due to the low oxygen level in the blood or a lower acidity level, the abnormal hemoglobin S can stick together in red blood cells, which causes red blood cells to become a sickle shape. This is why they are called sickle cells. A sickle cell crisis occurs when sickle cells stick to the vascular wall, get intertwined and clot together, which causes blockages in small and larger blood vessels. Your organs and tissue, therefore, receive less oxygen, which may damage them and cause pain. Although a sickle cell crisis can occur spontaneously, it is generally triggered by fever, infections, pain, cold, skin cooling down, low fluid levels, not drinking enough, or dehydration due to gastroenteritis or alcohol consumption, or other physical stress. These situations lead to reduced oxygen levels and/or acidity levels in the blood. When you feel a crisis coming on, it is important that you drink lots of fluids, not alcohol, and stay warm. If you have a fever or are in pain, take medication to lower the fever or ease the pain. As soon as the blockage is dissolved, your blood can flow freely and reach the tissue again, which is a process that is called reperfusion. The switch from first having low oxygen when the blood vessel was blocked and then receiving sufficient oxygen again during reperfusion leads to a chain reaction that releases certain substances, such as free oxygen radicals, that cause changes to the vascular wall. As sickle cells are broken down, more nitric oxide, or NO, is bound to the free hemoglobin in the bloodstream. This means there is less NO left over to do the job that NO is intended to do, which is to relax the muscles in your vascular wall, to widen the vessel opening so that more blood can flow through. A shortage of NO means that the muscles in your vascular wall contract instead of relaxing, raising the pressure inside blood vessels. In the lungs, for example, this can lead to pulmonary hypertension. The shortage of NO also leads to your system releasing a lot of ornithine. This is a substance that produces changes to the vascular wall. The smooth muscle tissue grows and more collagen is formed.